Welcome to the Transforming Healthcare Coaching Podcast, where we bring you guidance and coaching perspectives so that you can level up in your life and work.
I'm Klaus Grimm, your host for today's episode, and I'm thrilled to be here with you today. Our mission at Transforming Healthcare Coaching is to revolutionize healthcare by empowering clinicians and leaders like you to thrive both at work and in life. I'm excited to introduce to you our guest speakers today.
Hi, my name is Amy, life transition and career coach. From mind-body therapist to an ultrasound technologist, I've worked hands-on with thousands of clients. I understand the challenges of balancing work and self-care, especially in the healthcare field. We work together to ignite your inner motivations and line up your goals with your career and your personal life. Sometimes a simple shift is all it takes.
Hello, I'm Griselda Anguiano, mental health pediatrician and certified professional coach. My passion lies in partnering to empower parents as they navigate the joys and challenges of raising neurodiverse children, or as they themselves seek support for their own neurodiversity. Through a holistic and collaborative approach, I strive to foster resilience, understanding, and growth in families.
And I'm an emergency medicine and urgent care physician assistant and clinical assistant professor practicing in the Boston area. I enjoy partnering with healthcare professionals across all specialties, students, and frontline workers to empower them to thrive in their personal and professional lives by reclaiming joy at home and at work and turning their life goals into reality. So today we're talking about misconceptions in coaching. And can you share some common misconceptions people have about coaching, especially in the context of healthcare professionals?
So there's a really big myth in taking care of oneself, and that is the saying, I am selfish if I just focus on myself. And it seems to be a very common one that people think that if they are spending so much time and energy and money on themselves, that it's really taking away from other people.
Yeah, I think that's huge that a lot of people don't find the need to take care of themselves. And yeah, that's a misconception that they're taking away from others. And I think that's that level 4 energy that we talk a lot about in our coaching, that when we care for a lot of other people, it has this kind of disadvantage too, that you can suffer from this level 4 energy. And it's that you give so much to others that you're not giving to yourself.
The metaphor for that is when you're on an airplane and they talk about if you need oxygen, put the oxygen mask on yourself first. You can't help others if you don't have the oxygen yourself. And that is really the best way to help other people, is to give yourself that oxygen primarily so that you can take care of other people. So it actually proves that myth. It's a myth buster because it's not selfish.
So, another misconception is that life coaching is only for those who are struggling or failing. And so maybe some people might not want to come and say, I'm not having problems, or why are they trying to recommend I go get coaching? But actually, anyone can tap into their higher potential, to those higher energies, and outperform what they thought they could do.
Yeah. Another thing that's coming up for me as well, I think, Griselda, we actually talked about this in one of our episodes, is that a lot of times people think of coaching as therapy, and therapy sometimes gets its own bias, which it really shouldn't. Addressing your mental health issues, it should never be something that's not a priority. But I think a lot of people think of what we do as coaches is therapy, and we like to say a lot of times that it's therapeutic, but not exactly therapy. And I guess another thing that comes up to mind as a misconception is when people think of coaching, they think of like a sports coach or like a consultant or mentorship. But going to the analogy of the sports coaches, we aren't giving advice and we are not yelling at you, screaming at you. We're there to guide you and help you come up to the answers and awareness through your own thought process. We are your guiders in your life journey.
And to add a little bit more to that, Klaus, is if you go to the basketball coach, you're going to really learn how to play basketball. And the awesome part about coaching is you learn how just to be, right? So you learn ways and how to show up. And we've said this before also, but just the way you show up for anything is the way you show up for everything. So that's what I really loved about coaching, is being able to show up authentically the way you want to show up, and being able to tap into those higher energies, and everything that you learn with each session. They're going to be applicable not only at your work and how to show up for your patients more authentically, but also how to be there for your family, friends, even the environment.
Yeah. How you show up for anything is how you show up for everything. I think you coined that phrase, Griselda. I guess that leads us on to our next question. How do these misconceptions impact the perception and effectiveness of coaching for healthcare workers?
I find that when people may have had these misconceptions, once they start doing the coaching, they start to see the value in it and they break their own myths about it. And earlier, Griselda talked about sometimes people think just if they have problems, they get the coaching. So what happens is they start not only addressing some primary issues, some priorities in their life, but they start to realize they can start using this in all areas of their life and actually create new goals and improve, like you said, just their being and how they show up in their life. So it starts to just spread out and give them better results in their lives in many different ways than they did not expect.
Yeah. And I also find that these misconceptions that we just talked about are the barrier into people seeking help in the first place. And as you just mentioned, Amy, once they start to actually go through the coaching process, they break those myths from themselves. I think of my own journey of going through coaching, and that was something that I had as well. I don't need to be working with somebody to accomplish goals or to figure out what my life's all about. But little did I know that having that person that I could communicate with in such a confidential, safe manner, but in somebody who's an expert in guiding was important. And I think yeah, we break our own myths when we start to see the value in things.
I think a great thing to add would be the way we show up in coaching and with the first sessions being the ELI debrief. I think that is a great place to just start breaking some of those myths and that you really start to see. We're asking the questions, we're talking about the energy, and we really get to see how it's showing up in our lives. And we can hear that it's not only in the job, but it can be at home. It could be when we're driving, it could be when we're even the way we have fun or the lack thereof. But I think that is really helpful to say, okay, I guess I thought I was just coming for this, but now I guess it can help and shape in all the areas of my life.
I love that it's multifactorial, right? You come in for one thing and you get another added benefit. And I think that speaks to what we do at Transforming Healthcare Coaching with the energy leadership. That's what we like to preach upon a lot of the times is when you start to see where your energy is lying in certain aspects of your life and you start to address them, you start to realize how that actually affects other facets of your life in such anabolic ways.
I just wanted to add one more, Klaus. Somebody shared with me at the end of a series that they walked in thinking they were being selfish. They thought this was just such a luxury to do for themselves and spend all this money, and they couldn't believe they were doing it. And then they realized at the end, this is priceless because not only is this improved my life, I see how much it's affecting my family's life and in my job. It's like this ripple effect. And they just were so amazed at how valuable it was. And their initial misconception that this was just really a ridiculous thing to do for themselves, they were like, that is the last thing in the world I can think of now.
That brings up a great point is that a lot of people, and we're going to have a talk on this as well as the return on investment with coaching, but how do you invest in yourself? I think that is a big barrier for a lot of people is how do you say, I'm worth this amount of money? And a lot of the times I ask my clients, we go through some wishes. What are your greatest wishes in life? How much would it cost you if you had this wish come true? Thousands. I would pay thousands of dollars, millions if I had it. Say my wish is to have this beautiful house or this beautiful relationship that's crumbling, whatever it may be. That's worth so much money if you really think about it. So I thought I would give that little pitch there. So what advice would you give to healthcare professionals who are hesitant or maybe skeptical about engaging in a coaching relationship?
And even with what's coming up for me is just giving it a try. If you had that intuitive hit to reach out, or I do need help, or if someone's saying, hey, why don't you try coaching? Just maybe thinking that maybe there's a reason for that little nudge and let me figure it out. Right? Just to try to see if it's something that I could benefit from, and we know that it's not only can they benefit from it, but the world can benefit from it. And so just the patience and just that impact, and talked about ripple effects before, but just how it does impact the whole.
Yeah, and sometimes that little nudge that we need. And what's nice about what we all do is that we do offer a discovery call where you get to actually experience a short taste of coaching and see if it is a right fit for you, because it may not be a right fit for you. But from what you're hearing in these podcast episodes, this may generally be something that you could benefit from. And how else would you know unless you have this kind of tailored talk with a coach? So that might be something that, if you're listening on and curious about if that nudge is something truly you should be following on, talk to one of us and see if it really is.
Yeah, Klaus, I love that. And it's really an experiential, and it's an unknown. Just like when we have a big dream or a big goal and we really want to get there, if we knew how to do it, we'd already be there. And sometimes this dream or this nudge or this goal is what pulls us through to get there. And we just don't know it yet because we haven't experienced it. Same thing with coaching. For some people, they're like, what is this about? I've heard so much about it. And it's an experiential event. So sometimes people do have a hard time putting words on it. So just give it a try.
Yeah. The coaching process is all about you. And I think that's one beautiful thing to remember, is that you get to talk all about yourself, all about the issues or the goals that you may have, and be directed to make forward actions and making the changes that you want for your life in such a safe space, but also a space that allows for that quick development to happen, that oftentimes it may take months to years or never happen sometimes if you didn't work with a coach.
And I think another thing is that many of our listeners may be thinking like, okay, so this is just going to be focusing on healthcare or my part in healthcare. But just kind back to the beginning too, as far as it's going to help with the whole thing. So yes, you might come in because it's, should I leave? Should I stay? Should I specialize, transition, whatever it is that you're dealing with? But we take it all and we really focus on saying each client gets to decide what to talk about when we're going to meet. So if something is going on at home, that's what we're going to address. If something's going on in the office, we can talk about that too. So you're going to be getting to decide what you want to talk about and what you want to support with.
I love all this information and advice you guys have provided. As a healthcare worker, I can feel it and I can see this working for me. If you're listening now and finding that, hey, this whole coaching process might be for me, I encourage you to take that next leap and see if it really is. Book a free discovery call with any of us and let's see if we can make your dreams come true.
Thank you so much for listening to the Transforming Healthcare Coaching podcast. If you found this episode interesting or useful, please share this with your friends and colleagues in healthcare. And we will love it if you hit subscribe so that you never miss an episode. Leave us a review on wherever you are listening to us. It means a lot to us, and we actually read every comment. Also, we want to help with the topics and problems that you want us to talk about. Email us with suggestions, feedback, and praise at podcast@transforminghealthcarecoaching.com. If you want deeper support for your life and work as a healthcare clinician and leader, head over to transforminghealthcarecoaching.com and see how we can partner together to meet your goals. Download your copy of our free 5 reflection questions to jumpstart your journey as you level up in your life and work, and get on our email list. Be the first to know about our coaching programs and what's coming. Together, we can transform healthcare, one person at a time.